Hello and Happy New Year. My name is Andrew Hoffman. I'm with CompareMedigapCompanies.com. I'm a 20-year veteran in the Medicare industry, and today what I want to do is educate you about a lesser known enrollment period for Medicare. Everyone is typically very aware of the annual enrollment period, which takes place at the end of the year, but very few people are educated about the Medicare Advantage open enrollment period, which actually takes place starting on the first day of each calendar year. So today what I want to do is take this opportunity to educate you about what you can and cannot do during this 90-day window. So most people are familiar with the annual enrollment period, but a lot of people aren't familiar with the Medicare Advantage open enrollment period. When does this take place? Well, it's actually going on right now, but it starts every January the 1st and actually extends to March the 31st. Most people believe that the only time they can make changes with their Medicare plans is actually during the annual enrollment period. This annual enrollment period actually lasts from October 15th till December the 7th. And normally, if you don't make changes during this time frame, then you're basically restricted to making any other changes. And a lot of people feel that if they miss this opportunity, or maybe they made the wrong decision during this time, that they can't have any other options, which is actually incorrect. So one of the problems that a lot of people run into is they just run out of time for one reason or the other. That October 15th till December the 7th, it's about 45 days, but it actually goes by very fast. And here's some of the situations that you might run into where you run out of time. If you were looking to actually go into traditional Medicare, that process is very simple. However, if you go into traditional Medicare, usually an option that folks like to look at is a Medicare supplement. Medicare supplement typically fills in the gaps, many times the deductibles and the co-insurances that Medicare doesn't pay. The process to getting approved for a Medicare supplement can last anywhere from 2 weeks to 2 months. So this window of 45 days can actually expire before you get approved by a Medicare supplement. And the last thing that you want to do is disenroll from your Medicare Advantage plan and not have another coverage to kind of fill in the gap or to actually provide your Medicare benefits. Another problem that you might run into is if you applied for a Medicare supplement company, and maybe that one particular company turns you down for one reason or the other, and you wanted to apply for a different Medicare supplement. So now you're trying to apply for 2 different carriers to get approval during a 45-day window. Take into consideration, if you're making these changes, there are hundreds and thousands of folks who are also applying for a Medicare supplement looking for that coverage. And it does take a time for these insurance carriers to go through the process of getting you approved. So you might actually just run out of time. So one of the solutions that we have here is actually the Medicare Advantage enrollment period. And as I mentioned to you, that takes place during the beginning of every calendar year. This is actually an enrollment period that didn't used to be. It's something that Medicare actually enacted a few years ago. So we want to make sure that you have the opportunity to take advantage of this new enrollment period. So let's look at what you can do during this time. Number one, if you are in a Medicare Advantage plan, whether that Medicare Advantage plan has prescription drug coverage or whether it doesn't is irrelevant. So depending on which plan you have, you can either switch to a Medicare Advantage plan. So if you're one particular Medicare Advantage carrier, you decide that you don't like that carrier, maybe your doctors aren't in their network, maybe it's not providing the coverage that you thought it would, or maybe you just made a mistake, then you have the ability to change to another Medicare Advantage plan. What else can you do during this enrollment period? Is you can actually disenroll from your current Medicare Advantage plan and return to original Medicare. Medicare Advantage plans are commonly known as Medicare Part C, and original Medicare is commonly known as Medicare Part A, which is hospital services, and Medicare Part B, which is medical services. If you choose to do this, then you will also be able to join a Medicare prescription drug plan, which is Medicare Part D. So we really got the alphabet soup of Medicare plans that are available out there. it is important that if you have a Medicare Advantage plan and it does have prescription drug coverage inside of that plan, that when you disenroll from that, you're going to have something that's comparable. Typically, that will be a standalone Part D Medicare Advantage plan. So make sure that you're actually filling in every gap that needs to be completed so that you have the comparable coverage that you're looking for. Now, if you disenroll or drop your Medicare Advantage plan and you enroll in original Medicare, it is possible that you have special rights which would allow you to bypass underwriting by a Medicare supplement. That is not always the case, and if you do not qualify for one of these special enrollments, then what you'll have is you'll have to go through underwriting with the Medicare supplement companies. That means that they have the ability to deny your coverage for a Medicare or Medigap policy. You can always go back to traditional Medicare, but remember, you need something to kind of fill in the holes and pay what Medicare doesn't pay. So what can you do? If you enrolled in a Medicare Advantage plan during your initial enrollment period. Now, it's important to understand all the enrollment periods, and this can be confusing. The annual enrollment period, AEP, is actually October 15th till December the 7th. The initial enrollment period is actually when you first qualify for Medicare or take out Medicare Part B. So during this time, if you enrolled in a Medicare Advantage plan during your initial enrollment period, you can change to another Medicare Advantage plan with or without drug coverage, or go back to original Medicare within the first 3 months that you have Medicare. So if you made a decision when you first turned 65 or when you first qualified for Part B of Medicare, you're not happy with that decision, you actually have a 3-month window where you can actually go back to original Medicare. But remember, original Medicare doesn't pay the whole bill. So now that we know that what you have the ability to do, let's look at the things that you cannot do. You cannot switch from original Medicare, that's Medicare A and B, to a Medicare Advantage plan. That is only something that you can do during the annual enrollment period, October 15th till December the 7th. What else can you not do? You cannot join a Medicare prescription drug plan, a Part D plan, if you are in original Medicare. So that window has passed you by. You'll actually have to wait till October 15th to once again enroll in a drug plan through December the 7th, and your coverage won't be effective till January the 1st of that following calendar year. Now, you always have special enrollment periods, as if you came off credible drug coverage or if you lost drug coverage from your employer or from another type of plan, that can create a window where you could enroll into a drug plan. But other than that, you're going to have to follow these rules. What else can you not do? You cannot switch from a Medicare prescription drug plan to another if you're in original Medicare. So if you have original Medicare, A and B, and you have a supplement to pay what A and B do not have, then you typically have a standalone Part D prescription drug plan. You cannot change drug plans. So you cannot go from one Part D plan to another Part D plan during this enrollment. That is, once again, something that's only able to do during the annual enrollment period at the end of the year. So let's do the process here for these changes so that you kind of understand a step-by-step process and that you don't go without any gaps in coverage during the time. Step 1 is apply for a Medicare supplement, because if you're going to go from Medicare Advantage to traditional Medicare, you're more than likely going to need something to pay what Medicare doesn't pay. That's a Medicare supplement or a Medigap policy. Before you make that change, make sure you're approved for the Medicare supplement company. So whichever insurance carrier you decide to select, then apply for that Medicare supplement policy. Whenever you apply, Medicare A and B, traditional Medicare, will actually start the first day of the month that you enroll in Medicare. So let's say that you apply for a Medicare supplement policy in January and you get approved. You're going to want to make that Medicare supplement policy effective February the 1st. That way, when we to disenroll you from a Medicare Advantage plan, it will also start on February the 1st. Follow that same process, just depending on what month that you apply. So once again, if you apply in February, you're going to want your coverages to start on March the 1st. If you apply in March, you're going to want your coverages to start in April the 1st. This way, it gives you plenty of time to actually take the next steps. So once you have been approved for your Medicare supplement policy, congratulations, it's time to move forward. So now what we have to do is we have to disenroll you from the Medicare Advantage plan. That process is actually very simple. Being that you've disenrolled from a Medicare Advantage plan, if it had prescription drug coverage, we now need to have drug coverage. So in some of our previous videos, we actually show you how to shop for a Medicare drug plan and where you can actually get an unbiased approach and look at what all the carriers have to offer you. Once you find out what prescription drug plan is going to be the most suitable for you, you can enroll in that plan. Now, whenever you enroll in that plan, the following month, you will be back into traditional Medicare A and B. So once again, you don't actually disenroll from a Medicare Advantage plan. All you have to do is enroll in a standalone Part D drug plan. This will automatically disenroll you from the Medicare Advantage. Keep in mind, if you enroll in a Part D drug plan January 15th, your new coverage will not start till February the 1st, and your Medicare Advantage will not be disenrolled till February the 1st. It always goes to the first day of the following month. So the beautiful thing is, once again, is you'll be disenrolled from your Medicare Advantage plan starting on the first day of the next month. There are always special situations. What if you enrolled in a Medicare Advantage plan and you want to go back to a Medicare? Or what if you dropped a Medicare supplement and enrolled in a Medicare Advantage plan for the first time? If this was your first time ever enrolling in a Medicare Advantage plan, coming out of a Medicare supplement plan, then you actually qualify for a special enrollment period and you can take advantage of that. So when? Your chance to drop a Medicare Advantage plan lasts for 12 months after you join the Medicare Advantage plan for the first time. So in the previous year, during the annual enrollment period, you signed up for a Medicare Advantage plan. Sometime during that calendar year, you decide that this wasn't the best plan for you and you want to go back to traditional Medicare. If it is your first 12 months of being in that plan, then you can actually drop out of it. And you would try to re-enroll with the Medicare supplement company. Most carriers will accept you back, but some carriers, new carriers, if you weren't with them before, could require underwriting. So it's important, once again, to make sure you're approved with the insurance carrier, the Medicare supplement carrier, prior to applying for traditional Medicare and the prescription drug plan. I want to thank everybody for being on the call today. I appreciate that. If you have any questions, feel free to email us directly. My name is Andrew Hoffman. We're with CompareMedigapCompanies.com. If you're interested in comparing your current Medicare supplement policy to see if you have the lowest rates possible, feel free to give us a call or send us an email. We'll be glad to shop those carriers for you to make sure that you are saving and have the best value possible for your Medicare supplement. Thank you, and I hope everybody has a wonderful day. Take care.